This is the BrainSurfer software in which we're showing here the addiction network. The BrainSurfer software is inside of NeuroGuide. That's both a assessment acquisition software as well as treatment software in the area of biofeedback. There's a variety of different networks that one can select. You can see that I'm rotating BrainSurfer to show everybody what the addiction network looks like. The addiction network is made up of the Brodmann areas of the medial frontal lobes and the amygdala, hippocampus, cingula gyrus. And these are parts of the brain that generate dopamine. Individuals who are addicted will exhaust the supply of dopamine, dysregulate the neurons in the addictive network, which will give rise to craving, feelings of craving for the substance that they're addicted to. The goal is to first assess the brain by using quantitative electrical encephalography or quantitative EEG, then reset the phase using high performance neurological methods with pulses that are time locked to the peak frequency of the EEG, followed by rewiring of the brain by training the individuals to make this network green, completely green. The network will go from green to yellow to red. Red is 2 standard deviations or greater outside of normal. Yellow is 2 to 1.5 standard deviations, and green is 1.5 standard deviations or less. So the goal here is to train individuals to make this network green, which brings the brain into the proper homeostatic balance, in which one is reinforcing greater stability and greater functionality of the addiction network itself. This will reduce the feeling for the cravings, the craving aspect, as the addiction network becomes more normal and better regulated. This is a playback. There's no subject actually attached here because one can play back a patient or a subject's EEG and evaluate different networks of the brain. There's many different ones, including the attention network, the default network, anxiety networks, and other networks related to different problems that individuals can have. But this is the addiction network. The purpose being so one can see what the addiction network looks like in 3 dimensions. One can zoom in to particular nodes, which are Brodmann areas, and the lines between the Brodmann areas represent functional connectivity as measured by coherence and phase.